So this is the ship they say is unsinkable.
It is unsinkable. God himself could not sink this ship.
Iceberg, right ahead!
From this moment, no matter what we do, Titanic will founder.
But this ship can't sink.
She's made of iron, sir. I assure you, she can. And she will. It is a mathematical certainty.
Hello, CADCA, and it's great to be with you again. I hope you've had a phenomenal week as I've had, and this is a moment that I will seek to share my vision for CADCA with you. The video clip that you just saw was of the Titanic and this whole notion of failure of imagination, that these people could not believe that this ship was possible of sinking. And so what I want to do as we start on this journey is to be imaginative, to believe that all things are possible. And I want to be in partnership with you on this journey. Now, we saw the iceberg, and if you look above the surface, when you see an iceberg, it's the most beautiful thing that you could ever see. If you've ever seen an iceberg in the ocean from a ship, it's a remarkable sight. But the danger with the iceberg lies beneath the surface of the ocean. And so if we look what's above the surface, it's those things that we're doing right now. The first 5 bullets: increasing coalitions, increasing the capacity of coalitions as well as individuals within the coalitions, increasing our brand recognition, and continuing to refine the legislative and policy environment. Those are things that are innate to CADCA. Those are our strategic objectives within our strategic plan. And so you can rest assured that we're going to do those things every day, and we're going to work hard to do those every day. But here's a piece that I tell you that we got to focus on, is we have to really work at every level to remain relevant, both nationally and on the world stage. And I would ask you to do that within your locales and within your states. We have to create an environment that's supportive of primary prevention. Now, we've heard all kinds of things of big P prevention, upstream solutions, and small p prevention, those things that are downstream, like naloxone, like medicated assisted treatment, like expert. But we want to make sure that our focus is upstream solutions on primary prevention. And I want you to start using your resources within the state to focus on primary prevention as well. Now, in the short term, we're going to sustain ourselves and focus on our constant growth. The DFC pipeline is rich, and that will continue to be rich over the years. More people are applying, more people are accepting, and we have 9 NCAs planned for this year. That's up from 7 just last year. It's going to be very important that you all become a member of CADCA. Like American Express, membership has its privileges. There's all kinds of benefits, not just the reduction in prices for our training events, but also the Member Center, which provides you an opportunity to engage with other coalitions, to see what other coalitions have done to solve problems. It's also an opportunity to engage with our public policy consultant, Sue Thal, with me, and with those leaders in this movement around the country and the world. And then we want you to always attend our signature training events that are evidence-based. As you hear, evidence-based strategies. It's the latest and the greatest. And I want it to become a part of your natural order to attend both forum and mid-year. Different focus of the two. Deeper training, depth of training at mid-year. But you get the whole notion of public policy. You get a civics lesson every time you come to Washington from the National Leadership Forum. And so I want you to do both and make room in your budgets to do both. In the midterm, we want to grow. And that means we're going to have to bring more people under the tent through mergers and acquisitions, people like-minded. We're going to look to work with others who are in this space so that we can all be rowing in the same direction. We want to continue to create strategic partnerships and alliances so that this movement will become consolidated, so that everybody is working towards the same effort of making our community safe, drug-free around the world. And in the long term, we want primary prevention to become the standard. When you say primary prevention, there's a mindset, there's a picture that comes up. I want that picture to be CADCA, much as when you say you need a Band-Aid for a bandage. You say you want something to put over your food. You say Reynolds wrap or Saran wrap. I want CADCA to become that brand name for primary prevention. So you know our logo, which is trademarked, and many of you use it, and I should tell you that you should ask permission when you use this logo because it's trademarked. Not that we'll tell you no, but you should seek permission because it's trademarked for us. You know our mission of strengthening the capacity of community coalitions to create and maintain healthy, safe, and drug-free communities globally. You know our vision of a world safe, healthy, and drug-free. You also know our tagline of building drug-free communities. You're becoming more exposed to this expression of everyday CADCA trains. And I would tell you that if I show you the results from us, especially considering that we're global, that we're on 5 continents, there is training that's going on in our space that's led by CADCA or our trainers every single day. You know our brand attributes of being global, being collaborative, being innovative, being passionate, and being the leader, the recognized leader. And then this new motto that we're bringing forth, which is one CADCA. One CADCA, that is, we all work under one umbrella collaboratively for solutions that will affect the whole. So we know that history looks back and legacy lives forward. And we owe a great debt of gratitude to our leader, General Arthur T. Dean, who has now become the chairman of the board emeritus for CADCA. Well done, General Dean. You know that General Dean was the 9th employee here at CADCA. You know that his first forum had only 250 attendees. Now, juxtapose that with that we're having almost 3,500 now. In his first forum, the organization lost $50,000. He built this organization to what it is right now, of more than 100 staff, trainers, and consultants. He added the international program and added a youth component to our program, which is really the coin of the realm now with our youth. He breathed life into the Drug-Free Communities program that is perhaps the most successful and recognizable program within the federal government. And then he added the Drug-Free Kids campaign to build discretionary dollars for our use and other things. He put CADCA on the map, and for that we owe him a great debt of gratitude. General Dean has been the consensus leader of the prevention movement for the last 22 years. And for that we say thank you, General Dean. But let me tell you who CADCA is. CADCA is people. We have a board of directors of 20 people who match the coalitions, the sectors of the coalitions. We have members of Congress, we have CPAs, we have elected officials, we have lawyers, we have doctors of tremendous renown, we have college presidents, we have CEOs, we have people who are in the media. This is a board that brings gravitas and brings great inroads, offers great inroads to us. And very proud of every member of the board, and our new chairman of the board is the Honorable Mary Bono, retired member of Congress. We have this thing called the Coalition Advisory Committee. These are coalition people who give us a bottom-up perspective, of what's happening in the communities, the granularity of what's happening in your communities. These are the people that we reach out to that give us input. We do the national survey annually, yes, but these are people who are doing it every single day from every sector, Native American, Hispanic, urban, rural, frontier. They're all here, and they play a seminal role in CADCA and advising us on the changes that we're making. And then we have this remarkable staff of CADCA, and Alyssa Wendelkin is the new Miss Addie Lyles. Alyssa has been with me and served as my pseudo executive assistant when I was the COO when I started, and she'll bring tremendous energy to that position. And then we will hire a chief of staff for CADCA probably around the May timeframe. That's the headquarters. And then our secret weapon, Sue Thal and her public policy team of Chris and Alex. And then we have the world-famous, world-renowned Institute and Training Ops, which Pat Costello is the Vice President of Training and Operations, and she's the Director of the National Coalition Institute. And she has 3 deputies, one of which is Dr. Albert Terillian, who's over the evaluation and research team. And this is the evaluation and research team of Katrina and Carrie and our newest member, Jacqueline. Then we have also within her the new TOPS team, headed by the Robert Alvarez, who was the manager or director of youth programs. Robert is now on board, and they're doing customized training. The youth component is under there, and this is his team: Doug Rice, Ildiko, who is very new to us, Hector, who is now the manager of youth, and then world famous A3, as I call her, Angela Mbuma. And then this is our newest deputy director in the Institute, which is Dr. Joy Sweeney, the deputy director of training, TA, and outreach. And this is her team: Cass, Monib, Brittany, and then Selma. And what a remarkable team. And this is really has been our face to the field, these groups. Everybody knows these folk by name and know their extensions in CADCA. Then we have this remarkable international programs team led by our Vice President, Eric Ciervo. Irina Green is our consultant who lives in Israel, but her portfolio is really in Asia. She is the person who opened the doors to us for Kazakhstan, Tajikistan, and in Russia. The world famous, I call her GT, Evelina, who is a senior manager for international programs, and then Fabrizia Barrella. You know, it's amazing when you look at this team. There are about 8 languages that this collectivity speaks, and so that's why we're able to bring language or bring CADCA trainings in the native language. And then Geographic Health Equity Alliance with Andrew Romero as the director. Andrew's a phenomenal talent, has a teaching background, and he brings all of that skill and passion to bear in this job. And then Ikra Haji is his associate. Ikra is a person that's doing the newsletter that you're seeing, or responsible for managing the website for GIA, and they're doing phenomenal work. And then the world famous communications and meetings team led by Angelique Wilkins, Vice President of Communications and Meetings, with her able Deputy Director for Communications and Marketing, Relia Ugrinich, and then their teams of Sarah Lavoie, who does really the outward-facing print pieces, Bailey Martin, who is the videographer extraordinaire, who has brought studio quality videography to our organization. Your favorite and my favorite manager for meetings and registrations, Lady D, as I call her, Danielle Thomas, who plays a seminal role in getting everybody registered, and that's not an easy task. And then Kali Yeldale, who is our meetings and exhibits manager, who's brought a whole new skill set to our programming. And then we have business development and membership, which we call BDAM, which is ably led by Reiko Mendoza, the Vice President of Business Development, and our contract expert, Jennifer Sinfeld, and then Amy Pica, who is the Director of Membership and the online community. And that community under Amy's leadership has grown tenfold just since she's been at the helm. And then we have our own Lauren Blackwell, who's relatively new to us, but she's doing phenomenal work already. Here's the rest of the team. Mia Wallace, Senior Manager for Business Development. Sean Moore, who does special projects and initiatives. And then Sophia Elias, the Manager for Business Development and Projects. And Sophia is getting ready to have a little baby in the next 20 days that she'll call Julia. And so phenomenal team, rounding out our team. And then we have the AFIT team, Accounting, Finance, and Information Technology, led by our new Chief Financial Officer, CPA, James Borger, and then ably assisted by his Controller and Director of Human Resources, Megan Foxell. And then we have Daryl James, who is our Director of IT, with his able assistant, Tanya Mebane, and we have Celestine Brown, who's been with us for 21 years. She's the office manager for CADCA, and then Christina and Sean round out the finance and accounting team. And Christina has brought tremendous skill for a paperless CADCA in the financial realm. And so phenomenal organization with phenomenal people. We have scores of trainers who are been certified and do phenomenal things for us. 2 master trainers, you can see them there, our NCA certified trainers, our certified trainers, our coalition development coaches, and then other trainers that we have that we can put in place. And so these are the people who do the work around our states and do the bidding around the states. Here are the youth trainers that we have, led by Yvonne Stroman and our former employee, Melanie Piskai. But what a wonderful group, and my favorite, Colbert Prosper. Colbert, when I spoke in 2014, Colbert asked me a question, and I remember Colbert as a 13-year-old, and it's amazing to see them all grown up now. But these are our youth trainer, and you can see that we have both breadth and depth. And then this is the international team. And interesting about our international training, as I said earlier, we do training in the native tongue of the people that we're training. And so you can see our international trainers and the countries that they're aligned. So we're going to build on this saying or this expression that every day CADCA trains. And when you ask, well, what do we really do for you? We educate you. We equip you, for the things that you'll do in your communities. We empower you. And then we teach you how to advocate. And I'll talk more about each of these later in the briefing. So, advocating. This is how we best support you here in Washington, through advocacy. You all know our secret weapon, as I call her, the petite, maybe 5 feet on a good day with heels, Sue Thal. She is the master of public policy. She is our consultant, and over the last 25 years, she has restored over $3.15 billion, that's with a B, billion dollars to the prevention effort, to primary prevention effort. And Sue's expertise Capitol Hill Day is Sue Thal. The meetings with your representatives, that's Sue Thal, what you should say when you meet your representatives, how you advocate at the lower level, in your communities, that's Sue Thal. And so this is one of the things that we're proudest of, and our network is opened through public policy. We educate you. We train the fundamentals of prevention preventing substance use and misuse so that you can apply them to your communities. We reinforce that education with our primer series, with our practical theorists that we have, and you all have seen 10 on opioids, 11 on N devices, on electronic nicotine device delivery systems, and then the latest on the State of the Union of cannabis. But we're working one right now on which will be a refresh on alcohol and alcohol abuse, especially with teens. This is research that's funded externally. The last 3 were funded by NIDA, which we are very appreciative of that. And then the next one will be funded by NIHHH. We train you, we educate you also through our engagements at the National Coalition Institute, the National Coalition Academy, our Graduate Coalition Academies, our NCA boot camps, which is a new delivery system, which is a week-long course on the ins and outs of primary prevention. We equip you with sophisticated tools and strategies and resources, and you can see our youth here on Capitol Hill last year. We equip you through our coalition community communications, through our digital subscriber, our social media aspects, and in our virtual trainings that we've been offering since this pandemic hit. You can see over 2,000 discussions, plus 200 invaluable resources, and 10,000 members that's aligned, and we're reaching them every single day. We know that it works, and this is data that's taken from the ICF that they do an annual survey, and this is the survey. The left is since the inception of the DFC program, and then to the right is the last cohort that they assessed. This data is provided by ICF, independent, from us. But the thing that I can say unequivocally is that that data happens from the work that CADCA does. So I talked about this thing, this motto of One CADCA. And let me talk a little bit about what is One CADCA. View us as an umbrella organization, like a union. The union takes care of its members, whether they are dues-paying members or not. And so whether you're a member of CADCA or not, we advocate for you as a coalition. But under this umbrella is our board of directors, is our coalition advisory committee, the CAC that we spoke about, is our public policy consultant, our CADCA staff, our trainers, our coalitions domestically and internationally, all of our stakeholders and partners, our government agency partners, that if you see them listed, congressional committees that we liaise with and engage with routinely, our champions for drug-free kids, our humanitarians that we choose, our corporate partners. They're all under the umbrella, and you're under the umbrella as well. One CADCA doesn't necessarily mean this is all CADCA focused, but it's about the movement, that there should be one voice and one focus in our movement if our movement is to remain relevant. So, you put them all together, you advocate, you educate, you equip, and you empower, and that equals One CADCA. So here's what I need from you. And remember, relationship means reciprocity, that we should both be getting something. We should both benefit from this relationship. And these are going to be in priority. So what I need from you most is to become members of this organization. You strengthen, your presence strengthens our voice. Your advocacy strengthens our advocacy here. And so membership has its privileges. I need you to become members of CADCA. I need you to trust us, that we're doing the right things for you, that we're covering our bases, that we're making decisions with you in mind. Even if you don't agree with it, I need you to trust that we've gone through a mitigation strategy and we're making only choices that benefits our movement. I need to be in relationship with you. Over the last 4 months, I have had the opportunity to have virtual meetings with more than 60 coalitions, and that has been absolutely awe-inspiring and tremendously informing for me. My vision is what's coming from these meetings. And so I need to be in relationship with you. Know that you can reach out to me, you can call me, you can email me, you can text me. I want to be in relationship with you. I want to hear your voice. And so relationship is important. I want to be in constant communication with you. And so we'll continue to do CO. We'll continue to do our coalitions online. We'll continue to do our newsletter twice in hard print, twice annually. We will be in communication with you, and I would ask you to be the same, to do the same with us. Use the member center as well. That's a great opportunity for you to engage each other as well. I want to be in partnership with you. And partnership, I mean real partnership, where there is reciprocity, where we're both getting something from the opportunity and from the partnership. I want to be engaged with you. I want engagement with you. Invite me to your events. Invite me to your special days. Easier to do right now that we're in a virtual environment, but when COVID is behind us, when COVID is in the rearview mirror, I'll be coming out to see you. And so invite me, please. I want your feedback. We grow from your input. That national survey, the annual survey that we do, plays a similar role in how we modify shift left or shift right. And so please give us your feedback. We're a nonprofit. We work for food. You know, we can't do anything for free. One of the slides you saw that we hit the reset button twice a year. For government contracts, we hit the reset button on the 1st of October. For all other things, we really hit the reset button on 31 December. And we have to do it all again every year. All the monies that we raise, we have to do it annually. And so you'll have opportunities where we can provide customized training within your states. We can provide a Coalition Academy boot camp within your state. We can provide a full-up NCA within your state. Think of us when you think of your needs. Even evaluation services, we can provide evaluation services for you. And so view us not just from being members, from being in relationship, from being in communication, but I want you to think of us too when you need somebody to do business for you. We're here and we're ready to do that as well. And make introductions to your state and local leaders with us. You know, let us be a part of your solutions locally. And if I can be a part of your solution, please invite me in. Same with Sue Thal and the vice presidents on CADCA's team. So, at the end of the day, remember, we need to become one CADCA. I thank you for what you're doing every day. I thank you for the phenomenal work that you're doing during this pandemic. I thank you for the lives, scores of lives that you're saving every day as we build safe, healthy, and drug-free communities globally. Thank you.